Hello, I'm Michelle Rasmussen, Dean of Students in the University at the University of Chicago. This spring, the presence of COVID-19 within the college community has challenged all of us. We know that the extension of the stay-at-home order and the further delay of academic and co-curricular activities is really disappointing. The good news, however, is that through a recommitment to the UChicago Health Pact, we can still finish the quarter strong. To offer guidance, I invite you to watch the following information session with Dr. Emily Landon from UChicago Medicine and Dr. Ann Brody from Student Counseling at UChicago Student Wellness. Facilitated by our colleague, Jeremy Meunier, this conversation will provide expert perspective on the situation, the importance of the stay-at-home directive, and the support and resources available to students. Thank you for watching.
Great. Well, thanks both to Ann and Emily for joining us for this conversation. And Emily, I think we'll start with you to talk a little bit to begin with about the state of the virus and the pandemic at UChicago. We have these new variants and the cluster that appeared recently, and we have decreasing case numbers recently after a peak last week. But Emily, could you give us a little bit of context for what's happening now?
Yeah, so originally we began to see an increased number of cases in both, in mostly on-campus students last week. And the university was very quick to act because it was a lot more students than we usually have. But since then, we, along with contact tracing team and the Chicago Department of Public Health, have taken a very close look at the individuals that are part of this group and the contacts that they've had and the timing of the infections. And we're much better understanding now that this is not just due to one party over the Easter weekend. This is actually probably 7 different introductions of the virus into the community from individuals who traveled over spring break. Again, after that, we find that some of the people who got sick after having exposure to those individuals also traveled over spring break during the risk period. And so you can imagine it's kind of like a spaghetti bowl of links between hundreds of different individuals who are connected to one another through multiple interactions. Because of that, and because of the swiftness of the spread, the high proportion of symptomatic cases, the abundance of travel risks, and some really important preliminary findings on the laboratory testing, we are really worried that there are variants involved in this, and not just one. There could be many of these variants of concern that you've heard about in the news. For that reason, we need to be a lot more careful, even though the cases are coming down.
Right. Well, and let's talk about that a little more, Emily, about the reasons behind why the university and the Chicago Department of Public Health work together to extend the stay-at-home directive.
Yeah, so usually we have our contact tracing team reach out to all of the individuals that are infected and ask them about the different contacts that they might have had. And then we put those contacts into quarantine. This is a really granular and a way that we limit the curtailment of liberty that happens when you have to stay at home. Unfortunately, this situation is just a lot more complicated, and potential exposures were much more broad than just those parties. Some individuals were exposed in the time prior to the stay-at-home order, could still develop illness. We have to consider everyone in the entire class to most likely be exposed. That's why a stay-at-home order was the best choice. So you know that usually we do a 7-day quarantine if you've been exposed, and then we test you, and as long as you're negative, you come back out again. And if you choose not to get tested, you can do a 10-day stay at home. The thing is that this catches almost all the cases, but it misses about 5%, which has been fine for us on campus the entire time that we've been doing that. Now, unfortunately, when we have these variants, a lot of different affected individuals, and the inability to pinpoint those exposures, that number goes way up. And that's the number of individuals that may be missed by doing a shorter quarantine. So we've always known that our students need to have some up close and unmasked contacts. And we've asked everyone to keep those limited throughout the year, and people have done a wonderful job of this. But the strategy hasn't worked well right in this certain circumstance. And what we found is that some of the people who followed all of the rules exactly still got sick because there are just so many cases and it's so transmissible. For this reason, we really need to get the numbers on campus and off campus amongst our undergrads down to an extremely low number in order to be able to allow us to go back to behaving the way that we did before.
So Emily, can you help us understand why the restrictions are being extended again, even though the case numbers have actually been falling on campus in the last week or so?
We know the cases are falling, and we know that's because on-campus and off-campus students are doing a wonderful job, but we're still seeing some positives. And so we really want to talk about how to extend this as long as we need to, but not too long. So it's really about cutting your up close and unmasked contacts down to zero. If we break away from these restrictions too soon, we could end up back in another stay at home, because any one of those individuals could set off another blaze of infections, and nobody wants that. We've got to get to the end of the year strong. I know it may seem like you may be able to keep your contacts to zero even when you're out of the house, but like I said before, you could be wearing your mask a little below your nose or around someone who's just not taking as much care, or not being as careful as you need to be, not as far apart as you could be, and that can put you in a difficult situation without you even realizing it. That's why we've got to get those numbers now down. And when we do, then our campus will be sort of back to functioning normally, I think.
So how would you say that students and the university as a whole have been managing this cluster so far?
Look, we are really lucky. I'm impressed with how well we've done. I know it feels like this is the worst thing that could happen, and there must have been failure somewhere in order for everybody to have to stay at home. But the truth is, the system did exactly what it was supposed to do. Those tests that we do every single week in the dorms, that's what tipped us off. There's a little bit of a delay between the time that someone gets tested and we hear about it. And during that delay, there can be spread of cases. But that's a really reasonable delay for the fact that we use a very sensitive testing system. And we picked up on this cluster that ballooned over literally 48 hours worth of tests. Monday and Tuesday's tests, which got resulted on Tuesday and Wednesday, allowed us to make a determination. Our contact tracing team moved so quickly that we were able to get that stay at home in by Thursday. And the truth is, if we'd waited any longer, that stay at home would end up being a lot longer in the long run.
Let's look past this for a second. Let's look to the end of the restrictions and toward the end of the spring quarter. Are you hopeful that the college community can finish the spring quarter strong?
Yeah, absolutely. The college students at University of Chicago have proven themselves again and again to be really amazing at managing these COVID restrictions. It feels like a lot right now because you're stuck in a room by yourself, and it feels like the weather's improving, everything's getting better. You want this to be over more than anything. You've been through so much. And I know it's not fair, but biology is rarely fair. But in the grand scheme of things, it's not going to stop anyone from succeeding. Our students are going to come through this as strong as ever, maybe a little bruised, but nothing that we can't heal from. So when this is in our back view mirror, we're all going to feel better. And then you're going to go out and get vaccinated. So we never have to do this again.
We certainly hope so. Well, Dr. Landon, thanks so much for joining us today and sharing your expertise. So Dr. Aaron Brody, thanks again for joining us to talk about student counseling in UChicago Student Wellness. And to start with, I was hoping that you could give us a sense of how the COVID restrictions that have been underway have impacted people and how students and the university have been addressing that.
It has impacted the students and the whole community greatly. We are beginning to appreciate and more deeply understand the impact on mental health that all of this has wrought, and it's certainly true on our campus. That said, I want to say I'm very impressed by the way the university has been able to preserve what's possible for students and strategize around figuring out the problems. This is not what anyone expected their college experience to be like. This is not what first years coming to college thought their year was going to be like. This is not what fourth years expected their last year to be like. College is about, even at a rigorous academic place like University of Chicago, is about more than just that. Developmentally, it is a time when individuals are learning who they are apart from their families, and a lot of that has to do with their interactions in the world of the university. And they've not been able to do that. So that's been really hard. That said, I think the university has, again, done an amazing job of finding ways to keep things going. Students have continued with classes. The dorms have been open. all of the resources have been available. It's been, I think, a pretty amazing response. And I too have been really impressed with the resiliency and the creativity of the students in how they have managed all of this. And it's been hard. It's unprecedented. There was no rule book for this. And so we're all learning as we go.
Yeah. Well, and a lot of the work in student counseling, even under normal times, but especially in this time, is to help students think about how to manage stresses. So maybe you could talk for a minute about how students, how you work with students to manage normal stresses and the additional isolation of this period.
Sure. The problems now are not different, really, than they are under normal times. We see all the same things that we always see when students are coming in. However, the fact of the pandemic and the fact of the isolation is mediating everything and really exacerbating some problems for with some students in particular. And so managing stress becomes about what I say to students all the time is what works for you and how can we adapt that so that you can do it possibly in a little different way, but how can we help you to lean on the toolbox that you have already cultivated for yourself? Things that help all the time, like getting enough sleep, adequate nutrition, getting exercise, and social engagement are really important now, as they always are, and especially important now. Social engagement, ironically, in some ways, is even more important in the face of the kind of isolation students are dealing with. I will tell students, think of 3 people who you like to be in contact with and call one of them, if not every day, every other day. Make a plan to do that. Make a plan to set up a study group. Make a plan to, get together a group of students with similar interests. Call your mom, call your grandma, stay connected in any way that you can. Also, and this is something we tell students all the time about managing stress, especially now, take a break from technology. Every moment is spent online, classes, again, social interactions, keeping in touch with family. And it's really important that for all of us and for students as well, that we have a break from that. And so take a walk, read a book, detach, give yourself some time every day when you are not plugged in. And take a break from the news, for sure.
Absolutely. So you mentioned a minute ago that many of the things that students are coming with are similar to what you'd see in normal times. Let's just talk a little bit more, if you can, about what students are coming to counseling with. What are some of the common problems that you hear from students these days? And is that different from normal times?
Jeremy, it really isn't in some ways. It's not that the problems are different. I mean, we see a huge array of difficulties and challenges with the students who come in to see us. There is no problem too small or too big. That's what we say, and we want students to come to counseling with that. The difference is that there is this, I want to say, global worry or existential anxiety and uncertainty about the future that underlies everything. And for some people, it really exacerbates whatever anxiety, whatever else they're worrying about. It can make it much harder. And we work with them around those things. And we also ask students always, and so how are you doing? Are you talking to people? Are you getting out? Even if they don't bring it up. It's always there in the background.
Great. Well, maybe we can close for a minute here with talking about the kinds of help that student wellness offers and how students can access that if they want to contact you.
Sure. So we have a huge array of services available. I will initially put in a plug for our website, wellness.uchicago.edu. It lists all the many services that we have available through student counseling, also through health promotion, also through student health. We offer counseling, we offer emergency services, we have workshops, we have support groups for affinity groups. We do a lot of outreach, particularly with underrepresented groups. We have drop-in times that we've been able to do, offer virtually. It's a long list of services. And the main thing I would say is just call us. We're here to help. We also have a 24/7 number. Students can call at any time, day or night, and have a clinician to talk to, 773-702-3625. That's on our website. 773-834-WELL is the phone number for the Wellness Center. And like I said, we have a whole, array of support, therapy, psychiatric services. We have academic support and a number of workshops.
And again, any UChicago student can access services there. There's no extra thing they have to do. They just call and they'll be helped, right?
Absolutely. Any UChicago student. This is our mission. This is the group that we serve, is the University of Chicago student population.
Great. Well, we're grateful to have you, and very grateful to Emily as well for joining us today. And thanks to you both. Hopefully we'll be back to near normal before long, and really appreciate the conversation today.
Thank you.